Welcome in the governor of the state of Mississippi, Tate Reeves. And this is the first time that Governor Reeves has joined us on the air. But, Governor, it's not the first time that you've been on this show. You took up about an hour a day for about 2 solid months, somewhere in the April to May range with those press conferences. Really appreciate a few minutes of your time this afternoon.
Well, thank you for having me on, and I know your listeners are much more interested in talking about sports than listening to those long press conferences.
Well, it was funny. I was actually talking to somebody, and I don't know if you've kept up with this or anybody in your office has. I'm curious, do you think you've done more press conferences in your first year as governor than either Phil Bryant or Haley Barbour did in the combined 16 years that they were in office?
Well, I think that's possible. It's not because I wanted to. We just, when you consider the number of crises that we've dealt with, 2020 is a very challenging year. In fact, I was speaking earlier today with Governor John Bel Edwards down in Louisiana, and that hurricane is coming ashore somewhere around the Louisiana-Texas border, and he mentioned that it literally is coming ashore at the mean high tide of the month. In the state of Louisiana, which is going to cause significant additional water issues, obviously. And as I told him, in 2020, I would believe anything. And that's another example of just this being a crazy year.
So let's jump into kind of the recent sports involvement you've had. First at the collegiate level, it was Executive Order 1519 that came out last week that kind of set the standards for stadium capacity. And that affects Ole Miss, Mississippi State, and Southern Miss, 25%. We've had leaders from the schools tell us that they worked a good bit in conjunction with your office to try to kind of present plans and, all of you guys working together to figure out what was going to be best for each of the schools. What was that process like, and how did you arrive at 25% as the right number to begin the season?
Well, we did. We worked very closely with our university presidents and the chancellor at Ole Miss, and we worked very closely with the athletic directors, and we appreciate their involvement. We want to find a scenario wherein we can have collegiate athletics, but make sure that we can do so in a safe, responsible way. And so when you think about the individual stadiums throughout the state, and you actually take the time to break down the individual parts of those stadiums, for instance, the 25% rule is as it relates to the bowl, and we've had not more than 25% limit for outdoor venues for 4 or 5 months. And so we were just able to take our previous executive order and apply it to the football stadiums, because we know that we can put 25% capacity in a large outdoor arena such as that and do it in a safe way. And then you look at, for instance, we took the club area and we looked at it as a unique venue, if you would, and we took the outdoor part of club areas in Vaught Hemingway or in Davis Wade, et cetera, and we said if you're outdoor, those same rules are going to apply, the 25% rule. But if you're indoor, we're going to say that we're going to approach it as if it were a restaurant. We already have rules in place for restaurants. If you set up tables that are more than 6 feet apart, that you're sitting in groups of less than 8, then you can do that in a safe, responsible way, and we limit capacity there to 50%. And then we take each individual suite, and we look at them as an individual setting, and as long as folks are not riding up in elevators, for instance, with very large numbers of people, we can certainly get them in those suites, have half capacity, and do so in a safe way where we limit the likelihood of spread of the virus. We're not ever going to eliminate it. We know that, but we certainly can take necessary steps to mitigate and minimize the risk to the participants.
So, Governor, you pointed out that it's these large stadiums that allowed you to do that. We have consistently gotten text questions and Twitter questions and people asking, okay, what's the difference in these college stadiums being able to have 25% capacity and the high schools where you're only getting 2 attendees per participant, and I guess that's football and band and cheerleaders and kind of all of those rolled in. And there's considerable frustration because there are people who are like, well, I can't go see my grandson play, or my parents won't be able to go see their grandson play or their granddaughter play. So what's the difference in those two?
Well, first of all, the stadium size is a big difference. Certainly, it is much easier to do social distancing when you have a stadium of 60 or 70,000 than it is in some of the stands like they were at my old high school in Florence. But what I'll tell you also is we're continuing to monitor that. The biggest difference when we implemented the 2 per participant rule, it was in the middle of August. In the middle of August, we were seeing significant improvements in our numbers. But remember, it was July the 29th when we hit our peak, where over a 7-day period, we had 9,100 cases from Saturday to Friday. And so what we're hopeful of as we move and look out into September as college football comes online, we hope that there's significantly less community spread. We've certainly had 4.5 positive weeks in terms of the total numbers. And so I say the number one difference is the timing. If sports at the high school level had started, say, in mid-September, maybe we could have started a different area. But because we're continuing to see positive movement in the numbers, we may be able to loosen that a little bit. That's certainly my goal. But I would also remind everybody, and I know there's significant frustration out there by parents and grandparents and others, and justifiably so. I'm frustrated as well. But I will tell you, I spent the weekend in North Carolina. They not only have no high school sports, they have no youth sports in the entire state of North Carolina, at least until after the election. And so we've got to prioritize student athletes and making sure that those kids get on the field and to do so in a safe way to make sure that we don't see significant increases in numbers that stress our healthcare system. We've got to do it in a way that is maybe a little bit it's definitely cautious, maybe overly cautious according to some. And I understand the frustration, and we're looking at ways to loosen those restrictions.
Governor, you've mentioned the numbers a couple of times, and we're all kind of trying to follow the numbers, and maybe sometimes we know what we're looking at and sometimes we don't, and we're looking at these positive test results. And then as a backdrop to that, you get the story from the National Football League over the weekend where there was a lab in New Jersey that said they had some contamination issues that led to 77 false positives. I had a conversation with my wife this morning who's got a medical background. She was talking with the doctor who told her biggest frustration, the doctor's biggest frustration, is a lab that they're dealing with in Florida and the false positives. How can we trust the numbers from the test results? Or maybe the better question is, how are you deciphering what those numbers mean in terms of positives versus false positives and how much that should direct the decisions you're having to make?
Well, and that's a great question. And what I would tell you is I think you have to take every single number in the context of all of the data points that you have, okay? And so, when we first of all talk about total number of positive cases on a daily basis, that's something that's important to know. But what's really important is when the State Department of Health has the time to do the contact tracing. And so if you look at their website, they don't list necessarily the daily number of new cases because, again, if you test, that has some tests on Monday and some tests on Tuesday and some tests on Wednesday, and those are reported on Thursday. So what's really important in terms of that particular number is the date of onset of illness. And so when the health department has the opportunity to contact trace, to go back and talk to those who have tested positive, determine exactly when it was that they not only when they tested positive, but when they started feeling symptoms, that gives us much better data and much better information. There are a number of tests that are significantly less reliable than others. The serology tests are, for instance, more so. The testing that is done at our state lab certainly is more so. And then these tests that are more rapid tests in nature, they are definitely more susceptible to false positives and false negatives, by the way. So, well, the numbers that we really want to spend a lot of time looking at, because you've heard me say this, if you listen to any of my press conferences, everyone I've tried to say, our number one goal here is not to completely eliminate the spread of this virus, because the reality is that's not possible. That's not a plausible goal. I learned a long time ago playing sports and in education that you've got to have realistic goals that you can possibly achieve and possibly attain. Eradicating the spread of the virus is not one of those. But what is possible is that we slow the spread enough that we have a healthcare system such that every single individual in Mississippi that gets the virus that can get better with quality care receives that quality care. And so the numbers that really matter to me if you're just looking at 2 or 3 to look at, is total number of hospitalizations, total number of patients in ICU beds, and total number of patients that are on ventilators. And the good news with respect to that is all 3 of those areas have been coming down significantly for the last 20 to 25 days. And so, for instance, at our peak, we had 339 patients in ICU beds across Mississippi. Today, that number was below 235. So we're almost 40% below the peak.
Trending in the right direction.
Come down.
Yeah. Governor, the time is too short. I really appreciate you jumping on with us. Had plenty more questions. Maybe we can have another conversation again in the near future. Thanks for jumping on with us, and we'll hope that the numbers continue to go down so that those stadium capacities can continue to go up.
That's certainly my goal.
All right. That's Governor Tate Reeves joining us on the Farm Bureau phone line. We'll take a